Bienvenidos a Levántate y Brilla, el poder de levantarte y la fuerza para brillar. Este es un espacio para crear conciencia, romper el silencio y el estigma que rodea la salud mental. Un espacio para brindar apoyo, información y herramientas prácticas para fortalecer el bienestar emocional. Aquí comenzamos un nuevo episodio en donde podrás encontrarte y levantarte para tener la fuerza para brillar.
Hello and welcome to our podcast, New Horizons Support Team. My name is Paola Zaki and I'm a licensed mental health counselor in the state of Florida. Today we're going to talk about a topic that is very controversial and it's about ADHD. We have two people in the room. We're going to interview them and they have a new approach. It's actually controversial too. So we're going to hear about it and we're going to ask in the book many we will say like myths about it. So we're going to let them to introduce themselves. We have here Nohemi.
Hi, my name is Nohemi Parron and I'm a mom of two kids with special needs. And I'm a Melillo Method certified trained specialist. And we are also Brain Body Neuro Rehab, a clinic in Brevard County in Florida here, where we offer services to kids with special needs, autism, ADHD, dyslexia. Also we treat patients with brain and trauma, and we're going to talk about our approach, the way we help with these neurological disorders.
And we also have here.
Hello, I'm Dr. Daniel McBride. I'm also certified in the Melillo Method. I'm a chiropractor of over 30 years. Before that, I was actually a health and phys ed teacher, kindergarten to 8th grade. So there's always been this strong drive to take care of the children. And now that we've got the Melillo Method and our Brain and Body Neuro Rehab, we can really help the kids that are in the most need to achieve and come out of the ADHD and the autism that we'll talk about.
Yes, and it's very interesting. I was just talking to them and they were explaining to me about this new approach. It's an approach, actually, I never heard about it, so it's the first time for me, hearing about this approach. And I would like, the doctor to explain to us in which consists, because it's kind of he was explaining to me when we are born, right?
Mm-hmm.
Maybe would you say the ADHD is something we are born with and it has a cause of what are your perspective about this?
Absolutely. It's I got to tell you that it all stems from Dr. Robert Melillo. He put this program together because he started working with his own kids over 30 years ago. And you can say, yes, you can be born with it. Mm-hmm. But there's a difference between when we're talking about genes being genetic and maybe Down syndrome is a faulty gene in particular. ADHD is actually the way the brain is integrated, and a simple picture would be, imagine you have growth spurts. You get tall in first grade, then you get tall in sixth grade, and you get tall halfway through high school, and women usually stop growing earlier, sometime between 16 and 20, but not always, because everybody's different. Mm-hmm. And then boys usually finish growing, and everyone's different again. Boys usually finish growing by the time they're 24. Correct. Females' brains tend to mature quicker than guys' brains.
Yes.
And in anatomy, we know women's brains tend to be more bilaterally symmetrical. Men tend to have a little asymmetry. Women, as we talked about, remember the connection earlier?
Yes.
The corpus callosum, you don't have to remember that science word, but that connection in women is usually denser and stronger the two sides to talk to each other than in guys. So imagine the babies, like you say, this developmental thing, it's not a gene, it's a characteristic or a word trait. And you inherit your potential from your parents, but it's mm-hmm. not a genetic lock, and it's a developmental scenario. And if one side grows faster and stronger than the other, it tends to interfere with this one's growth, mm-hmm. if that makes sense. So then this strength, literally a superpower. These ADHD kids and these autistic kids, it's a superpower. What we try to do is get the weaker side to catch up to it. Now we're in. And that's imagine you've got an IQ of 140, but you can't talk yet. So everybody thinks you have no intelligence at all. Imagine what's going to happen when we get them talking. I mean, it's just the coolest thing you've ever seen.
Yeah.
And it's literally, even though it's becoming very popular now and Dr. Melillo's work is all over the place, it really is. It sounds new because even when I was in school 30 years ago, we didn't study this. It wasn't there.
Yeah, we didn't study this because, I mean, like most of the approaches that we do study is kind of like it's evidence-based, and you know, like a kind of like a CBT and DBT, and the approaches that we already know, like are kind of proof.
Yes,
you
yes,
know,
proven stuff.
objectively.
Yes.
Yeah, so like, can you say like, we talk about like this approach,
Yeah.
people are gonna be in the audience thinking like, what is this? Is this curing like autism, which is like, sounds like not realistic.
Yeah,
you know?
if we think about, like, we never talk about the word cure in the office. The idea, because that means there's a disease state, it's broken, we've got to fix it. When we talk about fix, all we want to do is get the balance back. It's literally, and I love when we're asked all the time about this, they're like, where's the evidence? I've never heard of it. It doesn't matter what you've heard of. I mean, like when I first heard of it, I had never studied this and it was brain stuff. So the idea is that Dr. Melillo and his research partner, Gary Leishman, these guys have hundreds of articles. And then we talked about the laser and how cool the photobiomodulation is. There are thousands of laser research supported articles out there. You can literally, if you just Google, for the audience, if you just look up low level light therapy, laser therapy, look up the ranges, whatever you want to look up, it's there in the research now. And it's a matter of 30 years ago, they didn't teach it to me, but I found it, and it's been a blessing ever since.
Yeah, I mean, when I went there, because I heard about Dr. Melillo, and the way that I learned about it is because a friend told me about the book that he wrote for parents. It's called Disconnected Kids.
Okay.
In this book, he talked to the parents. He tells us what's going to happen, what's going on in the brain, why your kid is doing this, what is the sensory issues. He even put a test on the book that you can do it yourself, so you can have an idea if your kid is more left asymmetry or right asymmetry on the brain. And
we're talking about the hemispheres.
Yes,
exactly. If your child
it's
can
like he
develop more
explained, and when he explained that to you and you read the book, you say, wow, but this makes sense. Nobody else explained to me. He's coming from a neurologist point of view. He's a neurology doctor. So when you start reading the book before you go see him, he wants you to read the book. And that's why everything started with us. That's how I started to know about Dr. Melillo. So the first thing he told me when I brought my kid, he was very nonverbal, very severe. He said he's the smarter of the bunch. He's super smart. He's just not able to show it because he's not regulated. And we don't want to change him. We just want to make him the best version of himself so he can shine and he can show us how smart he is. That was 2 years ago. I mean, when he was 10. A couple of years later, he's now 13. He's doing amazing. He's no longer autistic 3. He's a kid that is very independent. He's having a very fulfilling life. He's playing basketball in the Special Olympics and things.
The horseback riding?
He's there by himself, equestrian training. I mean, doctor can tell he's training we are training him now. Because
you are telling me like your child.
Mm-hmm.
He was 10 years old.
Yes.
He wasn't verbal.
He
was not regulated.
Mm-mm.
His senses were, so he was having these meltdowns, temper tantrums,
No sleeping.
not sleeping.
I cannot take him to do haircuts. I couldn't do anything. I couldn't do.
He had sensory issues, not able like maybe to eat, to like, it was.
Yes, and the saddest part for me is that I tried all the conventional therapies and I didn't know how to help him. And that really hurt me because I really want to help him. I see his body and he suffered. I see the pain in his body, his face. I didn't know what to do.
Do you try, I mean, like, all the approaches like ABA?
For years, for many years. But for his class autism and the way that all the support that he needed, the only person that was able to help me with that was this approach and Dr. Robert Melillo, and the way he understands how the brain works and how I can help my kid. That's when the first time I met him, I heard about primitive reflexes. I never heard about this. And he checked for that and said, oh my God, he had all of the primitive reflexes at 4. He usually, he will usually test the reflexes. So he go from point 0 to 4. 4 means is the highest level, and 0 means it's integrated. So when we start with
for
him,
the audience to know, kind of like to explain, can you explain to us, like, I mean, what is this? Because maybe they don't know exactly what they are talking, and kind of like if you can like give us a summary about like what is this, and because you're talking about reflex, and that we're gonna be like, okay, what the reflex has to do with.
we're all born with reflexes.
Yeah, of course.
Primitive reflexes are used to help the baby to get born. And they're supposed to be, and they're supposed to be integrated at the year of, when it's after a year, it's supposed to be integrated.
When you mean integrated, what do you mean by that?
I mean, they're supposed to be out of the body. They're supposed to be gone.
Okay, yeah, because we have like a stage of development in the humans, and we have like according to which month and which like year, we're gonna have some reflexes and we're not.
Yes.
You know, like the
From
motor
Exactly.
like the sparrows, yeah. So
they're supposed to be integrated as 4 months, 6 months, depending what reflex we're talking about.
okay.
So, sorry.
So by helping so what is like that? What is actually what doctor does? Is like he does an assessment based on the reflex.
Well, what we do is, that's one of the first things. As you're saying, the primitive reflexes are huge. It's not. Like I said, you're talking to a doctor before I studied Melillo's stuff.
Yes.
And the emphasis on primitive reflexes was just not there in our educations.
Yes.
And the idea is it's a bottom up development, and your primitive reflexes help the baby wiggle out the spinal gallant that you know about,
yes.
the back.
Yeah,
that helps a kid. Imagine
Even
a baby wiggles out as it's being
Yes.
born. But imagine you're 6 years old and you're wiggling all day in school because your spinal gallant is still there.
Yeah.
You're fidgety, you're hyperactive, you don't pay attention, and it's all because your primitive reflex, that's supposed to be gone in less than 9 months. I think that's like at 4 or something. Imagine you're 12 and you've still got a spinal gallant. You're a nightmare for a teacher, and you don't know how to control it because it's a reflex, like a blink reflex. You can't control that.
No, you
So
can't.
all these primitive reflexes, if we find them in someone older than a year at the latest, if they're in a 2-year-old, we're expecting delays because the brain stem is still in charge, and it's not letting the cortex, the big brain, take over because it's a bottom up development and then a top down control. But if this is still in control, then like we talked about the rooting reflex, an adult shouldn't have that. But after a head trauma, it may be there. Now I know their brain, we could say immature. If you still got a reflex, it's immature.
Immature, yes.
Okay. So, and what happened with the people, like if they are not having like a vaginal delivery, if they have a C-section?
Again, that's huge because these reflexes are there for that reason, to help. So what happens is if it doesn't get stimulated, it may be there longer and more out of place than it should be. So we check for but vaginal deliveries don't guarantee a problem either. We check for all these reflexes, we'll check them all, and if they're not there, it's not a concern whether it's cesarean or vaginal.
Cesarean,
The idea is the reflex is there for this. The whole vaginal process is hugely important for stimulating the baby, but at the same time, if it doesn't happen, that doesn't necessarily ensure any issues at all. But we check everybody. We check our adults with the same exams. We check our kids with the same exams. We check our babies with the same exams. And it's just a matter of how much they let us get through before. Because like if they're not regulated, they may not let us get very far into the test. So we know where we are. And we just start right from as far as we got.
So, and basically like what this kind of like a system, like what they do is like they use like what kind of technology or like what are the what is it? Because I mean, I'm thinking about like like it can be like ABA. We train the parents how to like positive reinforcement, extinction, negative reinforcement, not reinforced negative attention-seeking behaviors. So there is something like a system in place that we have, and it's also proof. So what you're saying is like you try to teach the kids or like adults also to regulate their emotions by activating the system that kind of like is not
Integrated, yes, we do that.
by doing
Stimulating the reflex. We stimulate it, manually stimulate it.
We do a lot of reflex stimulation. We do a lot of
Like,
exercises.
you can do it with a brush. You can easily
Okay.
stimulate this, and it will activate it. The most you stimulate it, the more it will integrate.
okay.
It
And-
takes months, it takes, depending how much. And we recommend it to do at least 2 times a day. And when we do the training, we not only do the training to the kid, we train the father, the
the
parents,
parents, yeah.
so they can continue and do the stimulation at home, because the brain likes repetition. And the first thing that you see when you get able to integrate the reflexes, the kids, the brain start to mature, start to go to the next level. The kid will start to do new things, new milestones. He will start acting.
And
not
get
like
regulated.
Yes, super regulated. He will start acting more his age.
Okay, kind
Usually,
of like, okay,
usually they are like a really immature, like a little kid. They're 12, 14, 15, but they're like a 3-year-old.
Yeah.
The way they express themselves and they carry themselves.
and this, I mean, like a system works better with the earlier the better, or it doesn't matter.
Oh, well, it doesn't matter in the sense that we get great results. I mean, this
Okay.
it's so cool. The idea is though, the earlier, the less the bad stuff
The
gets
less-
trained in.
Correct.
Yeah, like
and the
this-
regulation is a nightmare.
yes.
The-
Because
the-
regulate, yeah.
If we can train out the reflexes, that means top down is taking over automatically.
Yes.
And that means, we talked about it earlier, the frontal cortex, the executive function. Even kids have executive function to a certain extent. And the more regulated they become, it's for us, it's not a behavior problem, it's a neurological problem. And if
It is
we
a
deal with the
neurological
neurological problem, then the behavior fault will develop as the top-down control develops. So
Yes. So that's just the beginning of the therapy. That's just a little
That's
tiny
like,
beginning.
okay.
Yes. Then
Yeah.
we go into core exercise, because to have a strong brain, we need to have a strong core, muscle tone in the body, in the upper body.
Yeah.
So the better muscle tone you have in your upper body, the better brain connections you will have in your brain. And also, the doctor also mentioned that simple move, simple brain. Complex move, complex brain. So we want to also start working into the kids to start feeling their body, the muscle spindle. So the kids need to start doing push-ups. They need to start doing all kind of stuff that we do. Like
we're on the floor all
yeah,
day.
yes, we do a
Kind
lot
of
of
like
stuff.
exercising.
Yes, that's
Oh,
exercise.
lots.
Yes, like
Your
pull-ups,
wheelbarrow. Oh,
wheelbarrows.
yeah, like you were saying, the grasp reflex, the pulling reflex, looking for head lag. What else? Wheelbarrow, we do a lot of hangs
Yes.
for proprioception, body awareness.
We do side plank.
Oh my
we
gosh.
do full plank. We do.
All the
So
bear
it's kind
crawls
of
and
like a program
stuff.
that you guys have, and you do
Yes.
like an assessment on each child because it's
And then
kind of
prepare
different.
the program. Yes.
Yep.
And
Do
then
you like the diagnosis that you carry? Like what are kind of like the diagnosis or like the treatment that you do are for like kids on the spectrum, type 1, 2, 3, and then like there's no type, like there's no such thing as Asperger's anymore because now like they fall
No,
under
it's-
like
yeah, yeah.
the umbrella like of autism spectrum disorder. What other kinds of like
neurological disorders.
Yes,
Yes.
you guys
It will
too.
work for Tourette syndrome, OCD, ODD, dyslexia. What else, doctor?
No, that's absolutely. It's when
Any
Even
neurological,
OCD.
yes.
yeah, because that's not even part of like like the neurological.
it's literally
it-
it's think about like Tourette's and
Correct.
you've got what you have is a hyperconnection and your everything is super aggressive initiated on the left with no right brain inhibition. So now what's the difference between Tourette's a motor tic, and an emotional, totally they lose their control all the time. They have no emotional control. The only difference is the way they express the failure, the lack of inhibition, because
Cannot control it.
yeah, exactly. A Tourette's thing with verbal, that's just a verbal lack of inhibition. A tic is another physical
Yes.
lack of inhibition. Then you've got the emotional controls and these emotional dysregulations. That's a lack of emotional regulation. So once and all of those, most of those will be a left hemisphere, maybe even a real cool word, 2 words, basal ganglia, automatic function, right?
Yeah, basal.
So they lost control, and the left side is initiating all this stuff. And the right side, if it's weak, can't inhibit it. The right basal ganglia is not controlling its brother or sister, whatever it is. You're missing the balance. So if we can strengthen your right side, then that inhibits the unnecessary, because we all want to talk. Nohemi and I over-talk each other all the time when we're in the office, but the idea is, imagine you over-talk yourself all the time. You know you don't want to yell out curse words or yell at night or have them. What kid wants an emotional meltdown?
Yeah.
But they can't inhibit it, so everything we do, teaching top-down control, is to get that regulation of everything. I mean, it's really, it's getting that top-down regulation, and as we talked about earlier, the frontal cortex and everything.
Because I'm thinking like for kids who are diagnosed with ADHD, you know, like the attention deficit hyperactivity disorder, some of them, they are not impulsive. They are more like inattentive. You know, they can be the inattentive type, the combined type, but with them, how can you like help them to pay attention?
What is really cool? What is a lack of attention? There's 2 different types of lack of attention, number 1, for us. One is you cannot sit still. You initiate all the time.
Okay.
That's going to be a strong left. Weak right. The other one is you are so attentive that you pay attention to everything. Imagine a strong right hemisphere is your survival hemisphere. So your right hemisphere then says, oh, I heard it. Pretend you're first grade. The right hemisphere is paying attention to the teacher, paying attention, and then the kids move over here. So the right hemisphere, hyper attentive, looks over to see what the kids are doing. Then it comes back to the teacher. Now he missed something.
Yes.
Then something happens out in the hallway, a teacher and a student are talking, and now this hyper attentive side, exact strong right, this is now, it's lost its hyper focus left brother. It's not concentrated focus, it's focused on everything around it, because the right hemisphere wants to know it's safe, it's a good environment, and then it lets the left hemisphere get in. But if the left hemisphere is weak, and a good sign of that is dyslexia, or stuttering. No, that's I'm sorry, that's hyper. I said that wrong. Hypo is just dyslexia. So what happens if if the right is super strong, then it's paying attention to everything. It's actually a global focus as compared to the left brain hyper local focus. Does that make sense?
Yes.
So then what we do with someone with a strong right, we ramp up the left so that now they're paying attention to everything, but they really focus on what's important. The right doesn't rule out like
And
the
how
noise.
do you do it? It's
Oh,
like
man.
what kind of like, do you just use like the reflex or
We-
like
we
kind
use-
of like, or you
we
use
use-
like,
Everything starts with incorporating the reflexes we've got to bottom up, get rid of
What do you mean?
things.
Because I mean, we understand like sometimes people like the kids have like temper tantrums and they lose control. They have like, and we talk about like the upper brain, the lower brain. You know, kind of like we have different names for that.
Yeah.
Kind of like to control the emotions.
Yeah, well,
But
literally. I'm sorry.
How
go ahead.
you guys do it? Like when you say tapping means like tapping, like because
Well,
we do like also like EMDR. You know, like
Yeah, that's cool
but
too.
That's like
That's in the brainstem.
I know
EMD,
that's like
right?
part of that.
So
it has the
think
same
about
left brain.
yes.
But for the audience to understand, because I mean, like we're gonna be like they don't know about EMDR or they don't know exactly about like what you guys are talking. How can you explain to them, like something that maybe they can do it on their own, or
I
they
gotta
can
tell you, yeah.
actually like be beneficial, like
As,
for
no,
them
as
to.
Nohemi was saying, literally, if you can't get to us, I understand. The idea is get the book Disconnected Kids.
Okay, so
that
that's
book
number
is
one.
that book is that explains to parents what you can do. Then if you come in and we're dealing with it, now what we're doing is we use a lot of red and infrared light
Okay,
because
that's
of the
exactly what
penetration.
we're like. Okay, so
the
you
reason
use,
we
like,
use
laser-
the reason we
laser
use cold
therapy?
laser, laser therapy. Research is proven, and I got to tell you, thousands of research articles. Look up low-level light therapy. Low-level light therapy. It's there. It's done. So what happens with laser is we use between 600 and 900 nanometers. You don't have to remember that either, but that tells us the depth of penetration into the deepest parts of the brain. That's why I use a lot of infrared.
Okay.
What I'm doing now is, like, for example, I tend to be, there's a term called hypertactile, which means I'm very touch aware.
Yes.
I'm not, my mother will tell you, she's amazed I became a chiropractor because it's such a touch profession. And she said, of all my kids to choose a touch profession, you're not the one. And it's a joke in our family, I'm a terrible hugger. So I'm cool with that because that's not me, so to speak. But when I learned all this stuff, I'm also a right hemisphere dominant person. So I know the left hemisphere is more aware of the right body. So you see, I wear a jewelry ring, not related to anything. I wear this and I fidget with it all the time because I'm aware of it. I wear this because it stimulates my right side, which means my left hemisphere is on. It's 100% on right now because of this stuff. So then with that picture, I'm now training a kid with the same thing. So if you pretend you had a right hemisphere weakness. I'm going to talk to you into your left ear because that crosses over. When you look at me, you'll side eye most of the time. That crosses over to the right hemisphere. So everything I say and do is stimulating your right now. Everything she says and does stimulates the left. And when I'm dealing with the kids, then we laser accordingly also. Nohemi will sit on the right side and laser the right hemisphere while I'm over here doing tens or physical activities so that we're really turning the right hemisphere on. The laser gives it the energy to make changes, and this is the stimulation that we're doing. Does that make sense as a therapy?
That makes sense, yes. I'm trying to understand that because I mean, like, I was just like picturing my mind, like now when we talk about, we try to remember something. You know, like when we say like someone's talking and you're like looking, what side do you use when you have to like recall something?
Apparently there's also that's really cool.
The way I will explain to a mom, like it's the same way Dr. Melillo told me.
Yeah.
Okay.
Everything you do and touch on your right brain and your right side of your body, you will feel it. It will be feel in the left side of the brain. Everything you do on the left side of your body, it's gonna be feel on the right, and the opposite side.
But I don't feel it. So if I touch this, I'm not
No,
feeling
you
the
don't
left.
feel it. You feel your brain will feel
It's a
it.
sensation into your head,
okay.
and
Yes.
the left side, we do something really cool to test called sensory extinction.
Okay.
I do this with pretend I'm holding a
just show it
patient's
like,
hand,
okay.
and I'm doing this,
Maybe you can do it to me.
and they
like,
say,
show it like-
and you tell me, this is 0 to 10, does that feel normal? 10 is normal. What do you feel?
feels like a little like, yes, feels normal.
Okay. Now I'll try to do the exact same thing here. Feel about the same?
Yes.
Okay, then what you do, now I know by themselves both sides work. Because this one felt it over there about the same as this one felt over there. Then what I do is I try to do the same, and I'm doing this, and do you feel them both equally?
Yes.
Then with that would be globally normal.
Yeah.
Because if I do this and you're like, and I have you close your eyes with the patients and blah, blah,
Yeah.
if I do this and you're like, man, when are you going to start touching my right hand? I know that left hemisphere isn't feeling anything, and I'm hitting it kind of hard, but you know, it's actually more like this. And then if they don't pick that up, like, you know, it's there.
Yes.
But if you don't feel this one, if this is what you get, you'll say, doctor, when are you going to start touching my right hand? And I'm like, man, this one's in trouble. So then right? And then I go, okay, I got to stimulate her left hemisphere because, does that make sense? So
Correct.
the
So now,
testing and the stimulation is based on the hour-long exam
That
to
we do.
do all of this,
And
literally.
we check
Okay.
not only
Not only like-
the
And the parents
reflexes,
see it. Oh,
Yes, we
And
do
the
also.
parents can actually see
Oh,
it
yes.
because, like as humans we are, we have to see it to believe it.
Yes.
Very
We
much
just
so.
don't believe because we can also get excited about things, but we have to see it. So if you can test it and actually prove it, and that's gonna be
Right here, right now.
Yes.
Absolutely. The
So,
parents.
Yes.
And like Nohemi was saying, it's so important with what Dr. Melillo really established and drilled into us is make sure the parents get it, because they're going to end up spending more time with the kids.
Correct.
So that's why I can't praise the books enough. We recommend it to everybody, and it's also the idea that the parents are actually, in most cases, they're in the rooms helping us. Imagine you're totally emotionally dysregulated child. That child's not going to let me do anything.
No.
So what I have to do is ask mom and dad, okay, listen,
Come.
while I test these reflexes, make sure you hold on to them because they bite, kick, and scratch. That's why I don't wear a shirt and tie. And when Nohemi first met me, I was a shirt and tie all day.
Yeah.
But when I deal with autistic kids, anything's a weapon.
Yes.
So
Yes.
I'm in scrubs now.
Yes.
The idea is that they'll hold the child, and I might test one hand at a time. Nohemi will test the hand. We'll test the feet with the Babinski and things we talked about earlier. And like I said, depending on how far in the child lets us go, the parents are there the whole time.
Yes.
And then when the parents see changes, imagine after you're a week long.
How long can they see changes?
You can
2
usually
weeks, 3
see
weeks,
changes
or
within a week, within
wow,
days.
but that is impressive because
No, it is. Go ahead.
We usually work as a 2 weeks intensive program.
2 weeks.
Meaning
daily.
2 weeks, daily. The patient will come 2 times, 1 hour each. He will have 20 hours of intense training with us. We both together. So when we're working and we're stimulating the brain and we're doing all together, you start seeing changes.
So the kids you're saying the kids are able sometimes to sleep, to regulate, because we talk about
They should be regulated within a week.
that is impressive to me, because
Isn't
also to the audience, because I have cases personally, I was able to witness things, and also in my private practice. So we see cases where they cannot regulate. Parents try food, so they think sometimes food can change things because when they get too much sugar.
Yeah.
also
Huge,
affect
isn't
them.
it? Oh my gosh.
So
yes,
it
yes.
has to be so we have some evidence about the food. It helps also the parents learn.
We'll recommend
about
modifications all the time. You're absolutely right.
Yeah.
So also that.
Supplementation too.
Okay. We talk about different genetic mutations. We talk about I don't know, you are familiar about the MTHRF.
F.
And
Yes.
those kids and the incidents about it.
Yeah.
So we have some research, but this kind of approach is new to me.
Think about all of this stuff you talked about with the gene, with the dysregulation, the poor methylation,
Correct.
the
Food
food
regulation,
sensitivities. All of that is absolute fact. And we talk about all of it. Our emphasis is on the physical part, but we also have a huge bank of tests. If we suspect things, we literally start with a simple CBC with differential.
Okay.
And then we might throw in the inflammatory markers.
Okay, perfect. Because that is another
Huge.
huge.
And think about it. If in our case, because we're so neurologically based, if you have brain inflammation, do you also think, kind of rhetorical, but do you also think you're going to have gut inflammation? It's almost a
We
lot.
talk about
Maybe
this.
also food sensitivity too.
Oh my,
Correct.
huge.
And you can clearly see it. The doctor will come and see, check behind your arms. And the kids have a lot of little tiny bumps.
You have those histamine
Yeah,
You get
reactions.
those tests, because that has to do with gluten.
Yes.
Yes.
So
And that is
then
like-
immediately
that's
we say,
exactly-
okay, let's do the test for food.
Yes. Food sensitivity.
Sensitivity. Yes.
So because that is one of that.
So it
that-
will show in your body too. So we have a lot of markings that we can go and see. Oh, maybe we had to do this. Maybe we want to do that.
So this is I think a lot of people are gonna be excited. I don't want them to get super high excited and then
I'll let them get excited.
You know, because we not only treat one thing. It's a combination of things, and the main goal is to get the brain to work the best way and the more balanced way. And once the brain is working more balanced and it's it has a better symmetry. And then that means then your body start working better.
Yeah.
Your gut start working better.
Because there are some cases where like that for some reason and stage of development, some kids start showing the signs start like, I mean, you can see 18 months and they were fine, you know, according to the DSM-5, we have different like these pervasive disorders that start or begin at certain age. So also like some kids on the spectrum, they can start talking and they catch with all the, you know, like the stage of development milestones at age 6 or 5. So, and sometimes without treatment. So it might be because of like, why do you think it might be?
Well, there are so many.
Because I mean, we're attributing like reflex or
Well,
maybe
think
when
about-
the kid was doing some.
You have. It's really cool if I'm and hopefully Dr. Melillo doesn't say I'm making it too simplistic because it gets complicated. But think about the fact that you see your kids. I saw mine. You saw yours. You see your kids have physical growth spurts. Boop boop boop, or some hit it like the sooner your growth spurt starts. Usually, the shorter you're going to be, the sooner it stops.
Yes, especially for
The later it starts, the more height you usually end up with.
Yes.
So imagine you've got these little factors. Now add in what we call epigenetic factors. Your environment turns certain genes on and turns certain genes off. And some never get turned on, right? They just, because of the environment. So you've got to understand that kids could literally pretend it's like you said, you use the age 6. Man, everything was off. They hit 6 and things just took off and they caught up by the time they were 7. That is, things turned on and they caught up. They could have been a slow neurological growth or certain things didn't come on and then the environment was right. You had the perfect teacher. How do you fail through school? And then you see all these movies because one teacher changed their life. You know, that's an environmental factor that changed that kid. They didn't get smarter. They just got more confidence or something. So that's what we call an environmental or epigenetic factor. And there are times when you think, man, that kid's not gonna, there's nothing gonna work here. And next thing you know, they just explode on the scene and everything comes together. My youngest daughter was, she's a really phenomenal basketball player, Division I. And she literally was a late growth. We trained her to be a guard because she was so much shorter than everyone else in my family. Her 2 brothers are 6'4", 6'5". Her older sister is 5'9". You've met them. And my younger daughter, like this tall forever, but muscular. People thought she was a gymnast, but she hated that. So she literally, one of those right brain things, and next thing you know, she hits high school, and she goes from like 5'3" to 5'8".
Wow.
In like a year, 2 years maybe. And now she's a guard, trained, and then she's 5'8" and just buff. And it was that late growth spurt. The others started sooner. Well, the boys started late too, but her sister started sooner and stopped at like where she is. And then my younger daughter, that growth spurt kicked in and she took off. She went like 4 inches, 5 inches in less than 2 years. So imagine inside, the brain does the same thing with a child. And it's things aren't right, the environment isn't right, the stimulation isn't right. Next thing you know, everything comes together and that child's brain just comes onto the scene.
And the beauty of the epigenetic is that the brain can, when it's epigenetic, it can change. Yes, that's the beauty. When it's genetic, unfortunately, it's not much that we can do. But when it's something caused by epigenetic, meaning the environment,
and
the
we talk
beauty
about
is that it will be able to
maybe to adjust, because I mean, when we talk about genetic, it doesn't mean like necessarily it has to be something that we cannot change. Like in the case of like Down syndrome, it's something like you can actually see it. You see like the physical part, all the components. But when we talk about genetic, meaning like you carry
the gene.
You carry like not only the gene, because we don't know exactly what is the gene for like the mental disorders, because there is no such thing as like be able to predict exactly what is going to happen, because if someone has any condition in which kind of gene, because when we talk, because I mean there is no such thing as that. When we talk about like someone has like diabetes maybe, Well, diabetes can be treated now, but diabetes type 1, we know, like, like the person, like the pancreas is not releasing too much insulin. So it can be something genetic, we say that, because maybe the parents have the same condition and it passes it to the kids. But that is not something we can actually see it in a test until the person develops that. So when we talk about like, anxiety or depression, the parents, when we talk about like, we do history, sometimes the kids or like the family can say, I have the same condition and my mom has the same too. It doesn't mean we can see it. Actually, when we talk about the brain, it's very complex because we don't have something specifically for the brain. We treat like mental disorders, bipolar disorder, anxiety, major depression disorder, and most of them are the same medications, not for each one, but we say like treating the brain. What part of like the body do we treat when we treat depression or anxiety? We treat the brain. We know what to treat, like, but which part? So when those kids are with these issues, for ADHD, there are medications too, to stimulate some areas on the brain, because they say like they are like, it's overstimulated. That's what they refer with ADHD.
All the time.
So with your approaches, also a kid who is ADHD, but doesn't have any other condition, they are able to regulate better. So they are able to pay attention and if they are impulsive, to calm down.
Yes.
And you see it like in the practice, like actually you have cases where you are like, okay, so that is amazing because
Well, tell Raphael just started. Didn't Raphael talk the other day?
Yes.
Raphael is your son.
Yes.
Yeah, sorry, yeah.
Yes, my son. And the speech part is the more complex for the brain to develop.
Huge.
I mean, it's huge. But that kid, my kid, not only understand, he's very independent. He's doing a lot of.
He makes
He
food
makes
at
a
home.
lot of progress.
Yes.
And how old is him?
13.
He's 13 now.
And how old was him when he began this process?
He was
Like,
10. He was just 10. He
he
just
has
turned
been
10.
Just 3 years. So it's
Yes,
not
just
like
3
even
years.
like-
Yes, we're still treating him because that's the last piece. That
We just changed his therapy program a little bit.
Just to
Okay.
focus on the
Couple
speech
weeks
now.
ago.
Yes.
Yeah.
So we did a section last week, and the doctor and I, he's very good actually in working with it.
We talked about the cranial nerves and stuff. We added
We did a lot of photomodulation therapy with the lasers.
and the exercises.
Yes.
Oh my gosh, complicated.
So
movement.
that day we go home. This was just last week. I even have a recorded in my phone. I can show you. And I tell him, we have to go shopping. He loves to go shopping, but I mean go to the grocery store.
Store,
Yes.
like, yeah.
So I'm distracted doing something. He comes home and say, "Mama, mama, mama!" Like, let's go. And I haven't heard him talking, and he tried to say "mama," but it sounded like "mama," and it was so clear, and he was like "mama, mama, mama." So that
Wow.
really was
So that's
amazing.
like-
So we know it's gonna come. For him, it will take longer, but it's gonna come. We
That is great, because
Yes.
it's like something new. I
he
didn't know
understands
about
everything.
this,
He understands
but
everything.
they
Oh,
understand
he's
more than
great.
what they say. They are very
He
smart.
follows instructions, and not only that, he in the school he's doing A plus. He does everything. The computer, he's doing the multiplication. He's doing math. He showed how much he knows. He just needs to talk at this point after all this year of treatment.
So he's able to learn. He knows even math.
Oh,
like kind of like
yes,
adding or
yes,
like
yes.
numbers. But
Yes.
cannot say,
He
cannot
makes
say.
dinner. Look at a big
Because he
concept
needs,
like
like-
making
yes.
food. He knows how to put food together, run the machines to heat it up. He made you coffee the other day. You told me made
Last
coffee.
night he made coffee.
So he's imitating. So he's able to see and
He
And
learned
learn.
and he
Yes.
yes.
It's like,
Unbelievable.
that is great. That is like
Yes,
actually.
we
like a
think
good
he's gonna
thing.
be able to go to college. He's gonna be able to play in a basketball team.
His idea.
Wow.
He gets the concept.
Yes.
I mean, he probably cooks better than I do. My kids told my
Oh,
mother.
yes, for sure.
They literally say, "Grandma, never buy my father a crock pot again." It's the worst thing you could do. But Raphael knows how to cook food and make it taste right.
Yes.
13
13.
is compared to how old
He
I am.
packed his own lunch. He made his own eggs in the morning.
crazy.
Wow. And some
Yes.
kids can
And
be
that's the thing that I really dream of. When I'm not here as a parent, I want him to be able to prepare his own
Independent.
food, to be
Exactly.
independent.
I think
And
that's
he
like
even
for
looked
all
after
of
his
us.
little brother.
Yeah.
He
Oh,
put the
wow,
shoes
very
on.
protective.
Yes, the little brother is 7. He's like 7 years younger than him. And he had Down syndrome. And he protects him.
Yeah.
He knows that he needs help.
Yeah.
He helped
Okay,
him.
and that's like, yeah,
So
that's
he's
amazing
showing a lot
because,
of
like,
right brain
The awareness stuff, the
awareness,
empathy.
yes.
because that develop also like in a certain age.
Oh my God.
But that's like, I mean, impressive, and also like as all of us, you know, as parents, because we're here parents, we want our kids to like thrive in life, and by doing what? To be independent. You
That's
know,
what I'm doing
That's the
this.
only thing
That's-
we want, to
Yeah.
be independent so they can be successful in their own ways, but to be independent.
Yeah, and be happy too. I
Yes,
want him to
because
be
they're
happy.
gonna do like, yeah, they're gonna be happy. They know like, you know, what to do because it's up to them. We
Yes.
cannot choose like their careers or what they're gonna do. But with a kid like your kid, your concern is gonna be like that he can survive on his own
Yes.
when you are not
And
here.
that's what I want.
That's
that
for most
me,
of other parents.
That's for me is
Yeah.
the best. That's
Yeah,
right.
so he can. So that is a good thing. So now, like, we are like, I think, like with the times up. So we want just like to say something about, to tell our audience, like, is something, if you can give us something like practical that they can do. You know, for instance, like, I don't know, any movement, anything, something that it can be beneficial for them. Like to start like something that they can do by maybe like one processing the other one, or like,
Yeah,
because
it's, for example, if you
Yeah.
have a little kid and you see the kid having issues with the writing, and you see the kid having issues with turning on, or you know,
Right, left.
scrolling, yes, whatever.
Okay, yeah.
The thing that you can do is just simple the
Wheelbarrow.
wheelbarrow. Yes, hold the little legs and walk with it, like back and forward and backwards, forward
Okay.
and backwards. You're not only helping the reflexes on the
Palmar,
hands,
yep.
you're also helping the reflex on the back,
Yep.
also in the neck.
Okay.
So and it's pretty easy, and it's
And cross crawl
and
because
cross-crawl, yes.
you're doing both sides together. So you're actually integrating the hemispheres, the right and left brain. You're teaching them how to work together without even thinking about it. You're literally, we wheelbarrow almost everybody.
So can we do that to adults?
Yes, what we do instead of holding the legs, we make the bear crawl.
We do bear crawls.
Yes.
Yeah.
Okay, we're gonna do it. I'm gonna do it with my kids.
And we make it fun,
Okay, well, I really like appreciate you guys being here, and we're gonna like, I think it's not gonna be the first time we're gonna have you here, but I really like thank you for what you're bringing to this community.
Well, we really
Yes,
appreciate
yes.
you having us out. Thank you for having us.
Yeah,
This was awesome.
this is something.
Really.
I mean, we are really excited about helping these kids, helping this family. I mean, today my family, if you enter my house, it's a calm house. It's a happy house, you know.
Do you wanna like, I mean, let the audience know where are you located or where
Oh,
they
yes,
can
yes.
find you? We can also like write it in the comments, maybe like in the, you know, after this.
Oh, we are in 21 West Fifth Avenue and Suite G, and that's in Melbourne, Florida, zip code 32901.
It's literally right down the street on Fifth
Yes,
Avenue.
you can find us on Instagram, Facebook. We have a website too if you want to learn more about what we do. And our website is www.brainbodyneuroRehab.com. And
Okay.
then you can get you can write to us. It's the same, Brain Body Neuro Rehab @outlook.com.
And if you are actually like want to know more about it, you can also contact the Hispanic Center
Please.
or the Chamber of Commerce, and we can provide that information for you. You guys know, like we have like a neurologist and also like a chiropractor here, and another doctor. Like they provide services for the community when they don't have like enough resources. So we are available for everybody.
That's amazing. Thank you for
Thank
having
you.
us. Thank you.
Gracias por acompañarnos en Levántate y Brilla. Recuerda, no estás solo, siempre hay una salida. La salud mental es parte de tu fuerza. No tengas miedo de pedir apoyo. Síguenos para más episodios, herramientas y conversaciones reales. Hasta la próxima. Levántate con fuerza y brilla con propósito.